All right, so our patient was on Ozempic, was doing fantastic, ended up in the hospital, not because of Ozempic, but a lot of people just can't say every nausea, every diarrhea, every abdominal pain is from Ozempic. So in some cases it absolutely is, but there's also a norovirus outbreak and a rotavirus outbreak. So we have determined that it was not from your Ozempic. So we can restart you on it, but we're gonna start her on a much lower dose. So we're gonna microdose her for the first couple of shots, and then afterwards we can get you back on your journey. Ready?
Yes.
So remember to rotate the site, and then very easy, there's only one way to do it. You just inject and push the back, and then. Hey guys, happy Wednesday. So we all know that B12 is super important to make us feel good, but did you know there's actually groups of medications and medications that can cause a deficiency in B12. So what are they? And they're pretty common. So number one are antacids. So medications like Prevacid, Prilosec, Nexium, all of those actually decrease the amount of acid in your stomach. So the B12 does not get released from the food that you eat. So that is the first class of medications. The second class of medications are the H2 blockers, which are like Pepcid, used to be Tagamet, Famotidine. Those can also cause problems with absorbing by the same mechanisms. Another group or another medication is called metformin, and this is common for patients who are diabetic or if they have PCOS, and some people even take it for weight loss, but this can definitely induce a vitamin B12 deficiency as well. And last but not least, another group of medications are anti-seizure medications. So sometimes phenobarbital, but more commonly people who take gabapentin can also cause problems with absorbing vitamin B12. So make sure you're supplementing if you're on those medications. And remember, it's not very accurate to check a blood level because a lot of times this is a water-soluble vitamin and so it can fluctuate. Hey guys, so this is a great question. And it's not really a question actually, but this came up the first 3 patients of the day today. And a lot of doctors don't check it the entire panel that you need to look at to check your thyroid. So a lot of you might be like, my hair's coming out, I'm gaining weight, I'm super tired. And yes, it could be your thyroid, but make sure they're checking a TSH, a free T3, a T4, and antithyroid peroxidase antibody. It's a mouthful, but it shows whether you have an autoimmune condition called Hashimoto's, and all of that can be treated.